I have performed over 2,400 cardiac procedures in my career. I have published research on cardiovascular risk in peer-reviewed journals. I have spent 17 years telling patients and their families exactly what to do and what not to do to protect their hearts. And I almost lost my father because of something that happened in his bedroom at 6:47 in the morning. My name is Dr. Anderson, and what I am about to tell you is not a clinical case study. It is personal. It happened to my family. And it is the reason I am making this video today, because what happened to my father is happening in homes around the world every single morning. To people who have no idea that their ordinary wake-up routine is placing an extraordinary burden on their cardiovascular system at the precise moment it is most vulnerable. My father was 80, retired, reasonably active, no history of significant cardiac events. He woke up one morning feeling slightly off, not dramatically unwell, just slightly off, and by the time the ambulance arrived, he was in full cardiac arrest. He survived, but only barely. And the question that the ER physician asked me when I arrived at the hospital, a question I have thought about almost every day since, was this: what was your father doing this morning before the symptoms started? I did not know the full answer then, but in the weeks and months that followed, reviewing the timeline, talking to my father, cross-referencing what I know about cardiovascular physiology with what he told me, I identified 5 specific things he did that morning. 5 things that, individually, each place measurable stress on an aging cardiovascular system. 5 things that, combined, in the specific window of biological vulnerability that exists every morning upon waking, created what the cardiologist managing his care described as a perfect storm. 5 things that most people reading about this right now do every single morning. That is what today's video is about. Before I reveal the 5 mistakes, I want to ask you something directly. What is the first thing you do after you wake up? Not the first thing you intend to do. The first thing you actually do, reflexively, habitually, before you are fully conscious of your choices. Leave it in the comments right now. Be honest. Because the answer to that question, for most people watching this, is going to be on the list I am about to share. And recognizing yourself in this video is the first step toward changing the habits that matter most. The morning storm. Why waking up is cardiovascular combat. Here is the physiological reality that most people have never been taught, and that I believe every adult over 50 deserves to understand clearly. Your body does not transition smoothly from sleep to wakefulness. It detonates. In the minutes and hours before you wake, driven by your circadian rhythm, your body begins executing a biological program designed to prepare you for the demands of the waking day. Cortisol surges. Your adrenal glands release a wave of this stress hormone that elevates blood sugar, raises blood pressure, and increases heart rate, all in preparation for physical and cognitive activity. Simultaneously, your autonomic nervous system undergoes a dramatic shift from the parasympathetic dominance of deep sleep, in which heart rate is slow and blood vessels are relatively dilated, to sympathetic activation, in which heart rate accelerates and blood vessels begin to constrict. And on top of this hormonal and neurological storm, your body is severely dehydrated. You have not consumed any fluid for 6 to 8 hours. You have been exhaling water vapor with every breath. You have been sweating through your skin even without perceivable perspiration. The average adult loses between 0.5 and 1 liter of water overnight, simply through respiration and transepithelial moisture loss. The result of all 3 of these simultaneous processes, cortisol surge, autonomic shift, and dehydration, is a cardiovascular system that is, upon waking, already operating under significant physiological stress before a single additional demand is placed on it. The American Heart Association has published data showing that the risk of myocardial infarction is 2 to 3 times higher in the 2 hours following waking than at any other time of day. The Harvard Medical School research group that identified this morning vulnerability window called it the circadian peak of cardiovascular risk and attributed it specifically to the combination of cortisol-driven blood pressure elevation, sympathetic nervous system activation, and the hemostatic changes that make blood more prone to clotting in the early morning hours. Now, into this already stressed system, most people layer 5 additional cardiovascular insults, one after another, before they have finished their first cup of coffee. Let me walk you through each of them. Small mistakes can lead to big consequences. Here are 5 critical errors that could be holding you back or putting your health at risk. Mistake number 1. Jumping out of bed immediately. What most people do. The alarm goes off. They sit up. They stand up. They walk to the bathroom. In 15 to 20 seconds, they have gone from horizontal to fully upright and moving. What is actually happening inside their body? When you are lying down, your blood is distributed relatively evenly throughout your body. The moment you stand up, gravity immediately pulls approximately 300 to 500 milliliters of blood away from your upper body and into your legs and lower abdomen. In a young, healthy cardiovascular system, the baroreceptors, the pressure sensors in your carotid arteries and aortic arch, detect this pressure drop instantly and trigger a rapid compensatory response. Blood vessels in the legs constrict, heart rate accelerates, and blood pressure is restored within seconds. But in an aging cardiovascular system, particularly one already in the cortisol surge, sympathetic activation, dehydrated state of early morning, this compensatory response is slower and less reliable. The blood pressure drop that occurs when you stand up rapidly can be significant enough to cause what cardiologists call orthostatic hypotension, a sudden drop in blood pressure upon standing that produces dizziness, lightheadedness, and in severe cases, syncope. The heart's attempt to compensate for this pressure drop by accelerating sharply is called reflex tachycardia. And in an older adult with any degree of coronary artery disease, this sudden demand for increased cardiac output at a moment of vulnerability is one of the most consistent triggers for cardiac events that cardiologists identify in retrospective case reviews. A study published in the Journal of the American College of Cardiology found that orthostatic hypotension upon rapid standing in adults over 65 was associated with a 54% higher risk of major adverse cardiac events over a 5-year follow-up period compared to those without the response. The awakening minute. Before you sit up, before you move, lie still for 60 seconds. Breathe deliberately. Let your autonomic nervous system begin its shift gradually. Then sit up slowly. Pause at the edge of the bed for 30 seconds before standing. This 90-second transition costs you nothing, and it allows your baroreceptors to adapt incrementally rather than compensating for a sudden postural challenge. My father jumped out of bed every morning of his adult life. He was proud of it. He considered it a sign of vitality. It was one of 5 things that nearly killed him. Mistake number 2, not drinking water. What most people do. They wake up. They make coffee. They check their phone. They shower, they eat breakfast, and somewhere between 30 minutes and 2 hours after waking, they drink their first glass of water, if they drink one at all. What is actually happening inside their body? By the time you wake up, your blood is measurably more concentrated than it was when you went to sleep. The water content of your blood has decreased. The cellular and protein components, red blood cells, white blood cells, clotting factors, are packed more densely into a reduced fluid volume. In hematological terms, this is called hemoconcentration, and it has a direct and dangerous consequence. It makes your blood significantly more viscous, thicker, stickier, more resistant to flow. A cardiovascular physiologist colleague of mine once described morning blood viscosity to a patient using an analogy I have never forgotten and never stopped using since. In the evening, your blood flows like water. In the morning, before hydration, it flows like honey. And honey does not flow efficiently through the narrow, sometimes partially obstructed coronary arteries of an aging cardiovascular system. It pools at points of resistance. It forms clots at sites of plaque disruption. It creates the hemostatic conditions in which the morning peak of myocardial infarction and stroke occurs. The British Journal of Haematology published research demonstrating that morning blood viscosity is at its daily peak in the first 60 to 90 minutes after waking in adults who do not hydrate immediately upon rising. The same research identified this period of peak viscosity as temporally coincident with the circadian peak of cardiovascular event risk, suggesting that hemoconcentration is not merely associated with morning cardiac events, but is a direct contributing mechanism. The hydration minute. Within the first 5 minutes of waking, before coffee, before your phone, before anything else, drink 300 to 400 milliliters of room temperature water. Not cold water. I will explain why. Mistake number 5. Not coffee. Plain, room temperature water. This single habit begins reversing the overnight hemoconcentration before any other cardiovascular stress is added to the morning equation. My father drank coffee first, every morning, for decades. He never drank water until he was thirsty, which, as most adults over 60 know, the thirst sensation diminishes with age. He was routinely beginning his mornings with honey-thick blood and a stimulant that further elevated his heart rate and blood pressure. Mistake number 3. Coffee on an empty stomach. Before we continue, if you are finding this information genuinely useful, please take 1 second and hit subscribe. Every day, people who need this information are not finding it because the algorithm does not know this channel exists. Your subscription changes that. And the next 2 mistakes on this list are the ones I consider most urgent for anyone over 50 watching right now. What most people do, the alarm goes off. The first conscious decision they make is to start the coffee. By the time they are upright and moving, the coffee is brewing. They drink it before eating anything. What is actually happening inside their body? Caffeine is a methylxanthine, a pharmacologically active compound that produces its effects by blocking adenosine receptors in the brain and, critically for our purposes, by stimulating the release of adrenaline from the adrenal glands. This adrenaline release produces the familiar alertness of coffee, but it also elevates heart rate and blood pressure through direct cardiovascular stimulation. In the afternoon, when your cardiovascular system is in a stable, well-hydrated, post-activity state, this stimulation is manageable. In the morning, when cortisol is already peaking, sympathetic tone is already elevated, blood is already viscous and prone to clotting, and blood pressure is already at its daily high point. The adrenaline released by caffeine lands on a system that is already redlining. When caffeine is consumed on an empty stomach, its absorption is dramatically faster than when consumed with food. The gastric emptying rate is higher, the intestinal absorption surface is fully available, and peak plasma caffeine concentration is reached in approximately 15 to 45 minutes, producing what I describe to patients as a caffeine shock, a rapid, sharp elevation in sympathetic activity at the precise moment the cardiovascular system can least afford it. A study published in the European Heart Journal found that the combination of morning caffeine consumption and the circadian cortisol peak produced synergistic blood pressure elevations significantly greater than either stimulus alone, with the researchers specifically identifying this combination as a meaningful but modifiable cardiovascular risk in older adults. If you drink coffee, eat first, even something small. A few bites of food dramatically slows caffeine absorption and blunts the peak plasma concentration. Better still, delay your first coffee by 60 to 90 minutes after waking, after the cortisol peak has begun to descend. And drink your morning water before your morning coffee. Every time, without exception. Mistake number 4. Intense early morning exercise. Before mistake number 5, which I consider the most acutely dangerous cardiovascular insult on this list for older adults, please hit the like button if this video has given you something worth knowing. It takes 1 second, and it prevents this information from being buried by the algorithm. I genuinely want this to reach the people who need it. And I need to say this before we continue. Nothing in this video constitutes personal medical advice. I am a cardiologist sharing research-based information, not your physician. Please discuss any health concerns raised by this video with your own doctor. Your individual circumstances matter enormously and cannot be assessed through a YouTube video. What most people do, they wake up, they make their coffee, and they immediately go for a run. Or they do a high-intensity workout. Or they go straight to the gym. They have been told that morning exercise is optimal, that it sets a metabolic tone for the rest of the day, that the discipline of morning workouts is unsurpassable. And in many respects, regular exercise is one of the most powerful cardiovascular protective behaviors available. The problem is not the exercise. The problem is the timing and intensity. What is actually happening inside their body? Your cardiovascular system, during the morning storm we described, is already operating under elevated demand, elevated heart rate, elevated blood pressure, elevated cortisol, elevated blood viscosity. When you add the demands of intense physical exercise to this already stressed system, you are placing a load on coronary arteries that are simultaneously exposed to their highest platelet aggregability of the day, their highest demand for oxygen delivery, and the vasoconstrictive effects of the elevated sympathetic tone. This combination elevated oxygen demand from exercise, reduced coronary vasodilatory reserve from sympathetic vasoconstriction, and hypercoagulable blood from overnight dehydration, creates the physiological conditions for myocardial ischemia, a temporary but potentially catastrophic deficit between oxygen supply and oxygen demand in the heart muscle. In adults with subclinical coronary artery disease, which is present in a significant proportion of adults over 55 who have no symptoms and no diagnosis, this morning exercise-induced ischemia can trigger arrhythmia, plaque rupture, or frank myocardial infarction. A meta-analysis in Circulation, the American Heart Association's flagship journal, found that the risk of myocardial infarction during vigorous physical exertion was significantly higher in the morning hours compared to any other time of day, with the risk most elevated in adults who performed vigorous morning exercise in a fasted, dehydrated state without a prior gradual warm-up period. Do not stop exercising. Simply shift the intensity. Morning is appropriate for gentle movement, walking, stretching, yoga, light cycling. Reserve high-intensity exercise for the late morning or afternoon. When your cardiovascular system is stabilized, you have hydrated, you have eaten, and the cortisol curve has descended. If your schedule makes morning the only option, warm up for at least 15 minutes at very low intensity before elevating your heart rate significantly, and hydrate fully before beginning. Mistake number 5, cold water or ice showers. And here is number 5. The mistake I described as the most acutely dangerous for older adults. And I want to address it directly because cold exposure has become, in the wellness and longevity community, aggressively promoted as a morning habit with extraordinary health benefits. Some of those benefits are real. The research on deliberate cold exposure and metabolic function, brown adipose tissue activation, and mood is genuinely interesting. I am not dismissing the science, but I am a cardiologist. And my perspective on cold morning showers is the perspective of someone who has read the cardiovascular literature carefully and who has seen what happens when the wrong person applies this practice at the wrong time in the wrong physiological state. What most people do, they step directly from sleep into a cold or ice-cold shower. Many do this immediately upon waking, without prior warming, without prior hydration, in the fully dehydrated, cortisol-surging, sympathetically activated state of the early morning. What is actually happening inside their body? Cold water exposure on the skin triggers an immediate and dramatic peripheral vasoconstriction, a reflexive constriction of blood vessels throughout the skin and subcutaneous tissue, driven by the sympathetic nervous system. This constriction serves an evolutionary purpose. It reduces heat loss by diverting blood away from the cold surface and toward the core. But the cardiovascular consequence of this whole-body peripheral vasoconstriction is a sudden, significant rise in peripheral vascular resistance, the pressure against which the heart must pump. The heart does not reduce its output in response to this increased resistance. It maintains, and often increases, cardiac output. The result is a sharp, sudden elevation in blood pressure. In a young, healthy cardiovascular system with flexible, compliant vessel walls, this pressure spike is accommodated without incident. In an older adult with any degree of arterial stiffening, hypertension, or atherosclerotic plaque burden, the pressure spike produced by a morning cold shower can be genuinely catastrophic. It can rupture vulnerable plaques. It can trigger vasospasm of coronary arteries. It can produce the acute pressure elevation that drives hemorrhagic stroke in adults with hypertensive vessel disease. Research from the European Journal of Preventive Cardiology found that cold water immersion produced acute blood pressure elevations of up to 20 millimeters of mercury systolic in adults over 60, with the elevation most pronounced in those with pre-existing hypertension or arterial stiffness. The researchers specifically cautioned against morning cold exposure in older adults with cardiovascular risk factors, citing the additive effect of the cold-induced pressure spike on the already elevated morning blood pressure baseline. If you want the benefits of cold exposure, earn them gradually and time them appropriately. Begin your shower at a comfortable warm temperature. Spend the first 5 minutes warming and relaxing your vasculature. Then, only after you have hydrated, only after your body has had time to transition from sleep, and only with a gradual temperature reduction, not a sudden immersion, consider ending with a brief cool rinse. And consider shifting any serious cold exposure practice to later in the day, when your baseline blood pressure is lower and your cardiovascular system has stabilized. Now I want to give you something concrete, something you can implement tomorrow morning. Not a complicated protocol, not an expensive supplement, not a device. 5 minutes, 5 steps. That is the entire investment. This is what I now do every morning. It is what I recommended to my father after he recovered. And it is the morning routine that the cardiovascular physiology we have discussed today actually supports. Step 1. The awakening minute. Your alarm goes off. Do not move. Lie still. Take 5 deep, slow breaths. Inhaling for 4 counts. Holding for 2. Exhaling for 6. This activates the parasympathetic nervous system through the respiratory cardiac reflex, beginning the autonomic transition from sleep to wakefulness gradually rather than abruptly. This 1 minute allows your cortisol curve to begin rising in a controlled physiological context rather than into a system shocked by sudden movement. Step 2. The hydration minute. Sit up slowly, using your arms to push yourself up rather than using a sudden trunk flexion. Reach for the glass of water you placed on your nightstand the night before. Drink 300 to 400 milliliters of room temperature water over approximately 60 seconds. Not gulped, sipped steadily. This begins reversing overnight hemoconcentration before any other cardiovascular demand is placed on the morning system. Step 3. The adjustment minute. Sitting at the edge of the bed, feet on the floor, perform 20 ankle circles in each direction, slow, deliberate rotations that activate the calf muscle pump, improving venous return from the lower extremities before you stand. This precharges the cardiovascular compensation mechanism for the postural change you are about to make, dramatically reducing the orthostatic hypotension risk of standing. Step 4. The activation minute. Still seated, perform gentle shoulder rolls, neck rotations, and a seated forward bend if comfortable. These movements begin warming the musculoskeletal system and incrementally increasing heart rate from its sleeping baseline, mimicking the graduated warm-up that we identified as absent in the injury pattern of morning exercisers. Step 5. The transition minute. Stand up, slowly. Pause standing for 20 to 30 seconds before taking your first step, allowing baroreceptor adjustment to complete fully. Walk to your bathroom at a relaxed pace. Your cardiovascular system has now had 5 minutes of graduated transition. Cortisol is rising into a prepared system. Blood pressure is adapting incrementally. Hydration is beginning. You have given your heart the runway it needed. 5 minutes. That is the entire protocol. And the cardiovascular physiology supporting every single step of it is robust and well established. I want to end this video the same way I want every patient conversation to end, not with fear, but with agency. Your morning routine is not fixed. It is not inevitable. The habits that most people carry through decades of adult life were formed without knowledge of what the cardiovascular system is doing in those first vulnerable minutes after waking. Now you have that knowledge. And knowledge without action is simply anxiety. So let me be specific about what I am asking you to do. First, subscribe to this channel and turn on notifications, not for the metrics, but because the information I share here is the kind that reaches people who need it most only when the algorithm knows it matters. Your subscription makes that possible. Second, share this video. Not broadly, not abstractly. Share it with 3 specific people. The person in your life who you know jumps out of bed the moment their alarm goes off. The person who drinks black coffee as their first act of the morning. The person over 60 who does a high-intensity morning workout in a fasted state and considers it a point of pride. You now know something they do not. Sharing this video is not a passive act. It is, in the most literal sense, potentially life-saving. Third, and this is the most important ask, leave a comment below telling me which specific step of the 5-minute morning protection protocol you're going to implement tomorrow morning. Not eventually. Tomorrow. Write it down. Making a public commitment increases follow-through by over 60% according to behavioral psychology research. Your comment is your commitment. The ER physician who asked me what my father was doing the morning of his cardiac event was asking the right question. It was the question that, eventually, led me to make this video. Because the answer was not one mistake. It was 5. 5 ordinary, unremarkable, completely habitual behaviors that individually represent manageable cardiovascular stresses, and that together in the specific biological environment of early morning, created a storm my father's heart was not equipped to weather alone. He survived. He changed his morning routine. He now follows a version of the 5-minute protocol I just described to you. He is 83 years old, and his last cardiac stress test was, in the words of the cardiologist who read it, unremarkable in the best possible way. Prevention is the greatest act of love. For yourself, for the people who love you and need you to still be here. Start tomorrow morning, one step at a time.